Hello everyone. Welcome to the Rural Dialogues podcast. It's co-hosted by myself, Dr. Pratyush Kumar, and Professor Bruce Jeter. The podcast is a platform for advocating for rural health, featuring the work of rural health professionals and raising awareness about unique challenges they face. To begin with, we are inviting, in all fairness, the WONCA President-Elect candidates for a brief discussion. Our guest for this session is Pilar, who is also a candidate for WONCA President-Elect. We'll have a round of introduction. I am Dr. Pratyush Kumar, Chair-Elect for Rural WONCA and past Chair of WONCA Rural South Asia. Bruce?
Yes, I'm Bruce Chater. I'm the Present Chair of Rural WONCA, handing over to Pratyush in 4 weeks' time. And I'm a rural doctor in Queensland in Australia and the Professor of Rural and Remote Medicine in Queensland.
Maria.
Thank you very much for this kind opportunity and introduction, the opportunity to participate in this podcast of Rural Dialogues. I am Maria Pilar Astier. I'm a family doctor in Aragon, Spain, and I am honored to be candidate for WONCA President-Elect. I work for more than 20 years as family doctor and particularly more than 10 years in rural areas in my region. I'm as well an associate professor at the University of Zaragoza, teaching medical students, and then as well a mentor for family medicine residents, and I convince researchers to make evidence-based primary healthcare outcomes into the transformation of primary healthcare. That is my key message. Thank you.
To begin with, we'll just discuss regarding the critical challenges and solution. As a candidate for WONCA President-Elect, what do you see as the single most critical challenge facing rural healthcare professionals globally, and what are your proposed solutions to address it?
Well, globally, around 2 billion people living in rural areas currently in the world still lack of adequate access to essential health services. That is one of the biggest drivers of health inequities. And then most critical challenge is the shortage and unequal distribution of health workforce. Rural communities often have great needs and limited access to family doctor, but it's not only about numbers, but it's as well about the possibility that every patient everywhere deserves the same safe, high quality healthcare, and that is to promote robust, standardized training, family doctors, and that is essential to ensure this equity, quality, and safety, especially in rural and remote communities. I know you, WONCA Rural Working Party, has been clear on this for decades. You participate in different joint positions with WHO, calling for strong primary care as the cornerstone of the universal health coverage and integrating services, strong community participation, that is key, and attention to specific health needs in rural communities. From my own experience, I've been working as a rural family doctor. I saw this reality day by day and firsthand, and I visit seasonal migrants and workers harvesting fruit, elderly people struggling to reach secondary care, and women's associations trying to sustain communities. And as rural doctor, I have many challenges as well, facing how to organize health emergencies in the spot and as well organize the care with very limited resources and time. And yet, many young doctors have have little exposure to this experience, and I think one of the solutions, as you asked me directly, will be essential. Very early exposure and mentorship and community engagement are essential to maintain, recruit workforce to rural areas. So one solution might be this, and another solution, as I said before, just to set fair working conditions, equipments, and as well the possibility to work in multidisciplinary teams that ease the access of the population, and then incentives such as providing housing, providing good technology connections that will let people to do telehealth as well, and then the accreditation system. I think the accreditation system about quality and patient safety may be a key opportunity for rural and remote areas to thrive and improve as a way of working, thinking that learning from the issues that happen may help them to overcome these situations and improve for sure.
Thanks, Maria. I think you've hit lots of, as we say in English, nails on the head. You've pinned them down. I think exposure, fair working conditions, equipment, multidisciplinary teams, incentives. The one that's a thorny issue, I think, for WONCA, to be frank, has been that full scope family medicine is not optional for rural doctors. It's essential. Whereas in the city, rural doctors can go into niche areas of practice, so they can train as a family doctor, but then decide to do women's health or skin cancer or whatever. And so I suppose I'd like to hear your view about making sure that doctors can train to full scope and maintain full scope, because it is just, as I said, it's not optional in rural. It's something that's really needed. So
I think that you're right. the full scope of advanced competencies are crucial in rural areas. So we think that to be a rural doctor is always more like vocational practice, and I think to up-to-date all these competencies can be done through this support for governments and scientific societies as WONCA Rural, that helps rural doctors to identify what are the key competencies to develop and maintain. And these programs or accreditation might help to review from time to time those needs, because with quality and safety support, the teams are to identify the improvement areas. And if some people or some organizations from abroad come and see your practice and be beside you doing these accreditations, can support you in implementing those improvements. As well, the role of scientific societies as rural WONCA is key to maintain these competencies, to identify what are the needs for those rural and remote doctors who strive to do the excellent practice for the communities. And in my country, for example, when we practice in rural areas, we do the full scope of primary care competencies there as family doctors. We are now supported with different equipment to provide point of care diagnosis tests and point of care ultrasound, and supported by telehealth that might help us with the exchanging of information with the specialists, although we are quite far from the reference hospital. However, when rural doctors need the peer support, and that's what rural WONCA can offer to them, and creating rural doctor networking, and as well the rural seed. I think that to involve young family doctor being in rural and remote areas, supporting and mentoring them is essential. Then in my own region, when you get older, you quit rural areas and you go to urban areas and you miss that way of practice. You are in a big city, and then the team decided to specialize. Some people doing more women practice, or high blood pressure, or cardiovascular issues, or other more specialized care. But the way you do the home visits, the way you visit the community and talk about the global problems of their health, they are thriving because the condition of work, the context, it's really very satisfying, and as well very challenging, and have to be supported.
Thank you. And so we'll move on to the most important thing as a role as WONCA president. It's to manage different working parties and special interest groups, because they are the powerhouse of WONCA. And I believe that as if you elected as WONCA president, how can Rural WONCA as working party effectively contribute to the global mission of WONCA? And conversely, how can the global WONCA organization better support the initiatives and advocacy efforts of Rural WONCA?
Well, Rural WONCA has always been a driving force within WONCA, and its rural health conferences, its statements and policy papers, and the rural state movement are examples of leadership, creativity, and determination in family medicine. I see Rural WONCA as both the backbone and the guiding light of WONCA mission in place, and it keeps us focused on the truth that equity in health begins in the most remote places, and that family medicine must belong to all people everywhere in the world. So as candidate to President-Elect, I believe WONCA must do more to support Rural WONCA by ensuring rural voices and representing them in high-level advocacy, means in the corridors of WHO, United Nations, international organizations that are working to improve primary health care, and then providing more resources to young doctors initiatives. And that is crucial because they are the future and they are settling in rural and remote practices, and promoted rural practice research. As I said before, I'm a convinced family doctor, that we need to ground family medicine, evidence-based research information to report to governments to improve healthcare decision-making regarding how our role is effective, improve the survival of people, reduce hospitalization, reduce overprescription and overdiagnosis as well. And we keep a balance between the wellness of the people. We are really doctors of persons, we are not doctors of diseases. So that is key to show it with research evidence. And then linking rural priorities to the global agenda, specifically in different projects, and negotiate with governments to recognize the role and to support not only through words or statements, but with the budget as well. Then this connects to my campaign priorities, because one of the key messages is the collaboration with public health in community care, because rural doctors naturally bridge medicine, bridge agriculture or economic resources in the region, education, and social support. So they are really a fundamental pillar in the developing societies of remote areas. In my region, in Aragon, the reality was really simple. We were involved in all the community activities and with the town halls, with the network of enterprise that provide work to those temporary workers and try to guarantee that the conditions are fair and equity, and then that leads to a healthier community and a peaceful relationships among the community. That is the peace is as well health.
Thanks. I think you've hit some really important points there, and I think it's about family medicine reaching or being known in community. And I think particularly in rural communities, that often rural communities miss out on family medicine. They can get sometimes public hospital services, but it's much more difficult for them to understand family practice, and that I really like your idea of getting into the into the vision of the communities a bit more. Have you got any particular things that you think would be useful to do that, and particularly I think for rural doctors, rural family physicians, to get the education and the updates they need, because it's very easy for doctors in cities, whether it's your cities or Pratyush's cities or my cities, just to turn up to a dinner or turn up to a whatever. But obviously trying to get those resources and the special resources that are needed for people to really extend their skills, sometimes to quite an amazing levels, doing cesarean sections in rural areas and doing other things. So have you got any particular thoughts on that as to how you'd be able to support rural WONCA in that?
Well, I think nowadays we have the technology, and that is crucial to include, as you did a statement and a policy recommendation on digital health, e-health, and telehealth, and that is crucial for family doctors to improve their practices and to keep updated. And when I work as family doctor, our Wi-Fi connections were very poor, and we couldn't sometimes no possibility to use the electronic medical record or the electronic prescription and software, or trying to connect to people in remote areas. But nowadays that has been a very important revolution, and I think we have to guarantee within this equipment for rural settings these connections that will amplify the way they work in, and they will amplify the network to keep connected. Instead of turning up and being with friends and colleagues in the cities, we can then use the Zoom meetings and the webinars that I think you as Rural WONCA have produced several ones and have a good audience, and then you can follow them synchronic or asynchronic, because we have such a variety of different times in the world that sometimes when you perform the webinar, there are some people who can just synchronize with it, but other people need to follow it afterwards, and that offer a lot of possibilities. And as well, the mentorship program, I think, is really very human, and mostly with family doctors to exchange peer-to-peer experiences. Sometimes we have to face difficult situations during a period of times, and we need feedback. We need to exchange our own experience with a peer that can support us and can give some tips and can keep connected and supported us, because it's essential to be there and to be supported to face these challenges. Can be complex patients, and as well the situation of becoming a second victim, for example, after an adverse event in a very remote area that impact you, and as well sometimes difficult the relationship with the community, how you can overcome and thrive and survive this situation with the support of your colleagues. That's crucial.
Yeah, thank you. I think a lot of things might be we must be in agreement with you, and must have our priorities and your talks, it seems to be in constant agreement. But in last 2 minutes, I'd like you to speak regarding a campaign that why someone should vote for you as a WONCA President-Elect, just in 2 minutes, and then it will followed by Bruce Jeter's closing remark.
Okay. Well, I have 5 priorities to work in the next years if I've elected, if I honor it to be a family president-elect. That is strengthening primary healthcare teams with special attention to underserved regions, including rural and fragile settings across the globe, promoting the culture of quality and patient safety as a tool to promote improvement in very rural and remote areas, integrating family medicine into medical education, and then rural placements for students that should experience family medicine, rural family medicine directly in every country, because that will help us to improve the vocations of medical students. Once you can love what do not know exactly. So, and then for family residency programs as well, to have the opportunity for a standardized curriculum including rural practice, and raising the visibility and influence of family medicine, and particularly those working in rural and remote areas that are the cornerstone of the health equity in the world. And then finally, fostering collaboration between family medicine, primary care, and public health, advancing in community health models with using health assets from the community, social prescribing, and as well planetary health. Because family doctors in rural areas, they are completely connected with the impact of planetary health. They live with the people that are living from agriculture, cattle, and they suffer fires, they suffer floods, they accompany people along their lives and along these issues that are happening because of climate change as well. So I think these are the 5 priorities. Thank you.
Thanks a lot. It was lovely talking with you. And now to Bruce for his closing remarks.
Yeah, look, thanks very much, Maria. I think it's clear you've had some experience in rural, and I think that's fabulous. And I think it's also good that you've got such a clear plan. It might be good actually for you to share the plan with us, just so we've got those 5 points and we can include that. But thank you very much.
Thank you to all. It's really a pleasure to be connected. Your work shows the true meaning of my campaign: global commitment rooted in the community, and I think we can work together to enhance primary care.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye.
Thank you very much. Have a nice day.
Yeah.